I came
Good
late.
opportunity.
Let me say Happy New Year to all of us on tonight. We're excited to be back in session for the Muskogee Municipal Authority meeting for today, January 11th, 2021. Roll call.
Mayor Marlon Coleman.
Here.
Deputy Mayor Derek Reed.
Here.
Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy McGee.
Here.
Tracy Hoos.
Here.
Item number 1.
Consider approval of MMA minutes December 14, 2020.
Do we have any discussion or questions concerning the minutes or a motion to approve?
Move for approval. Second.
Been properly moved in second. Further discussion? Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes, the item passes. Item number 2.
Consider approval of MMA claims for the month ending December 31, 2020.
We've all had an opportunity to review the claims. What is the pleasure of the committee?
Move for approval. Second.
We have a motion and a second concerning the claims. Any further discussion? Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Same.
Alex Reynolds.
Yes.
Evelyn Hibbs. Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes, that will conclude the MMA meeting for tonight. We will now call to order the Muskogee City Council meeting for today, January 11th, 2021. Please join us for the invocation by Vice Mayor Derek Reed, followed by the flag salute.
Shall we pray? Oh Lord our God, we come, first of all, just thanking you for the gift of life. Thank you for letting us behold the beauty of another day, knowing that we didn't deserve this day, but by your grace, your mercy, and your love, you allowed us to see this day. Ask that you would just look upon our community, bless the pandemic that we are facing worldwide, as well as bless the civil unrest that we are going through in our country. Just ask that you would just bring peace on earth. These and many other things we ask in your name. Give you glory and praise and thanks for in Jesus' name. Amen.
Please join us for the flag salute. Attention. Salute. Pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We will now consider the minutes from roll call.
Mayor Marlon Coleman.
Here.
Deputy Mayor Derek Reed.
Here.
Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy McGee.
Here.
Tracy Hoos.
Here.
We will now consider the approval of the minutes for the City Council special call December 7, 2020, and regular session December 4, 2020. Do we have any discussion for the minutes or motion to approve?
Motion to approve. Second.
We have a motion and a second. Any further discussion? Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. We will now consider the consent agenda, which consists of items number 1 through 6. Do we have any items from the council that they would like removed to the regular agenda?
Move for approval.
Second.
The consent agenda has been properly moved in second.
Mayor.
If I may,
Yes.
I just want to point out that agenda item number 2, forgive me if I'm speaking too soon. Agenda item 2 was approved in committee subject to street committee approval. The street committee did meet last Friday and approve it. It is on the consent agenda. It does not need to be removed, but I did want to point that out, that fact out. Forgive me for jumping in there, but it is appropriate to be considered on consent agenda.
And we want to remind all of those watching that item number 2 with the approval of the Streets Committee will be one of the largest streets projects that we've seen at one time in Muskogee. It will do the northeast zone, and it is the first streets project to be done using CIP money. All of the other streets projects that we've seen going around the city at this time have been from the regular operating budget. So we are very fortunate that what we see now will likely quadruple in terms of the effort that the city is making to improve our streets. We have a motion and a second on the consent agenda. Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Item number 7.
Receive report and recognition for city council and council appointees diversity training.
Counselor Stout.
Yes, a while back, the council attended diversity training, and I'd like to invite Reverend Cutler to the podium now to make a presentation.
Mayor Coleman, City Council, Councilor Stout, thank you for this time. Do unto others as you would have them do unto you. That's a phrase that we've heard from playgrounds down through the years, all the way through today. We've witnessed civil unrest in our nation because we failed to remember that rule, to learn how to do unto others. We don't have to agree with each other, but we learn how to respect each other. And I believe that's what this diversity training helped us to see. Thank Councilor Stout, because of something that took place, an element of the community was offended. And she took great courage to come to a room filled with Black Baptist pastors. And that's a nerve-wracking thing in and of itself. But she came and she addressed our questions. She addressed our issues. And she would not leave until she did that. And after leaving that, she committed to attending this diversity training. Because, let's be truthful, all of us have some prejudice in us. You don't have to say, man, I'll say it myself. We all have differences. We all have different viewpoints. But what we must learn how to do is accept one another, learn how to work with one another. And I believe after she committed to take this diversity training, and then the city council was so gracious to join her in this effort. And we say thank you. You are our leaders. From you, this city moves. You fight, we fight. And so we commend you for the work you do. And so we want this training to go forward. And I thank the ladies from the diversity training course from One Oak and Tulsa who came to be a part of this. It was a 4-hour training. It was two 2-hour trainings. And so I want to present these certificates. They're not in order, but on behalf of the NAACP, you honored your commitment, Councilor Stout. We're here to say thank you. And then, thank you. Go ahead, you can give it. And then to your comrades, the city councils that joined you in this effort that did not have to, but we say thank you. It simply reads Certificate of Completion. This certificate is proudly presented to for successfully completing the City of Muskogee Cultural Diversity Training recommended by the Muskogee NAACP, which taught participants how to be more aware of diversity issues in the city of government, as well as provide skills to help them interact, collaborate, appreciate, and work more closely with people that have different qualities of their own. This is presented, and I'll just call you. I'd like to first present to our mayor, Mayor Marlon Coleman. Then we're going to present to Councilor Jamie Stout. I don't know how you all are doing because of this pandemic. Y'all figure that out. Just do it.
Councilor Stout, I'll leave that to your discretion.
You want to come down, or
Okay.
everybody can just come down and...
Okay. Councilor Jamie Stout. That's the one I was looking for. Councilor Jamie Stout. Thank you. Mayor Marlon Coleman. Thank you. Councilor Stephanie Morgan, excuse me. Thank you. Councilor Tracy McGee. Thank you. Councilor Evelyn Hibbs. Thank you. Councilor Dr. Tracy Hoos. you. And then not only did City Council participate, but then some of the staff members. City Manager Mike Miller. Thank you. City Attorney Roy Tucker. Thank you. City Clerk Tammy Tracy. Thank you. And then City Councilor Alex Reynolds. On behalf of the NAACP, again, thank you. Thank you for completing your commitment and your word. Thank you, City Council.
Thank you, Reverend Cutler. I turn the floor back over to you, Mayor.
Thank you, Councilor Soudan. Again, we salute you for your efforts to take us down such a necessary presentation. Item number 8.
Receive presentation of financial audit for City of Muskogee Foundation for fiscal year 2019-2020 and take other necessary action.
Mr. Miller.
Yes, yes, you have in your packet the audit from the City of Muskogee Foundation. Was a clean audit. Frank Merrick and staff from the City of Muskogee Foundation are here to answer any questions, and I'll turn the floor over to them for them to address any questions that you may have.
Do we have any questions or comments for Mr. Merrick on tonight from the council?
I just have one question where it says program expenses in 2019. We gave out $21 million. Is
Yes, ma'am. I can elaborate a little bit more. We kind of operate on a June 30 or July 1 fiscal year.
Mm-hmm.
We make grants year round, and so sometimes it looks like we make a whole bunch more in one year than maybe another year, and it's the timing of when those grants go out.
okay.
Do we have any other questions for Mr. Merrick? If not, let me say to Mr. Merrick, as well as that entire foundation board, certainly we thank you for the efforts that you make to make certain that the foundation funds are used for the benefit of Muskogee. And we would be remiss if we didn't make that comment on tonight, so thank you very much.
Thank you very
Do
much.
we have a motion to receive and approve the audit?
Move for approval.
Second.
Properly moved in second. Further discussion from council? Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Item number 8. Item number 9.
Consider approval to enter into a memorandum of understanding between the City of Muskogee and Muskogee County Emergency Medical Services due to the global COVID-19 pandemic or take other necessary action.
Chief Teehee.
Yes, this is a MOU between the EMS and the Muskogee Police Department that will allow us to assist them with when they get overran with calls, basically. Because of the COVID pandemic, there's been a high volume that they are stressed at times with regards to their ability to send truck to calls. What this does, and you all have a copy of the memorandum in your packet, basically allows a medic to ride with the police officer, and we would take them to those calls, and then that medic would have the ability to find out whether or not they need an actual ambulance there or if they can handle it there. It's not anything that we're expecting to have to do today or tomorrow. It just puts everything in place for us to assist them if need be. And I have Trish here as well that I think wants to say a word as well.
Thank you.
Good evening. So our time on a task or a call has increased significantly because we're having to transport these patients a longer distance. We've already put a medic out at the hospital for hospital bed delay for an extension to the ER. A lot of times the patient will be on a bed delay and we'll be sitting out there for hours at a time sometimes because we can't get a bed. So with putting a medic out there and taking care of that patient, we're able to get that truck back out on the streets and to run more calls. Now, with the increased length of transport time, sometimes to other states, we're looking at Fayetteville, Arkansas, Kansas. So we have a long transport time. Our transport time has increased from like 39,000 minutes since April of last year, and now this is fleet time, 39,000 minutes to over 64,000 minutes since last year. So that's why we're looking at possibly doing this with the police department. Now you got to understand that we're not the only ones getting overwhelmed with calls. Wagner County, Cherokee County, who we have an agreement with, a mutual aid agreement with. So if we have trucks available and they call us and we have those trucks available and they have an emergency call, we respond. We've responded, and Tulsa County has actually asked us to respond to emergency calls, which is going to possibly cause a delay in our county. Now, if we have one truck, two trucks available, naturally we're going to try to keep our county covered the best we can. But who knows when an emergency call is going to come in. We may have 5, 6 trucks available. Tulsa County may call us, and we may turn around and get 7 or 8 calls within 20, 30 minutes. So with placing a medic on or in a car with a police officer, they're probably going to have their own medic bag, an AED, cardiac monitor, so they'll be able to monitor that patient and first respond to that call, so we can definitely take care of our residents. Does anybody have any questions?
It's a great partnership, and that it will benefit the community.
It really is.
Mr. Mayor, may I be recognized?
Yes.
You say having a police officer in the car with the medic?
Yes.
Has the rules changed? Because before up here, the police officer had an option to wear a mask or not wear a mask. What is the rule now, Mr. Attorney or Mr. City Manager? Because like I say, it was a week ago, I was going down the road, and I seen a couple of police officers had some people pulled over. They walk up to them, and I wasn't in the right lane because I was going to video this. So I had to turn around and go back, but they didn't have masks on. So when I went back towards McDonald's, that's where they was right there in my McDonald's parking lot. No mask whatsoever, but when I went back, one officer was in the car, doing his report, I guess, and the other one, I guess he decided to go ahead and put a mask on. And I still have a problem when I'm going down the road and I see officers not having masks on. And you're going to tell me that these officers are going to put a mask on riding around with your paramedic and how this virus is? I have a problem with that. That's just me. I don't know how the mayor or the other councilman up here feel, but when I see this, it upsets me because everybody should be following guidelines and rules. So I would like you to tell me how this process works, Mr. Miller or Roy, about the mask situation.
So our policy is if employees are in a car with someone else, they'll have a mask on. In this case, they'll be with someone else and they'll have a mask on.
Okay, when they're on the street like I was talking about just a while ago.
So that policy hasn't changed over the many times we've talked about it over the last few months. It's
so
the same.
This policy, what I'm saying is, so the person that they had pulled over or around, that person still has to ask them to put a mask. Is dangerous this situation is here?
I had a citizen this week, yesterday, tell me they talked to an officer.
I hate to interrupt you, but that's kind of getting a little bit off topic because we've moved on from talking about the partnership of EMS and PD to the PD policy as it relates to masks and private citizens, and that exceeds the scope of what the agenda.
My apologies to the council for getting us off track. My apologies.
Well, I'm glad, like I said, I just want to see that when the officers are riding with EMS, that they do have masks on. That's me up here saying that.
Right, and our policy at the ambulance, if we have 2 medics that don't live together, because we do have some spouses that work together, they're supposed to wear masks inside the ambulance.
Okay. I turn the floor back over to Mr. Mayor.
Thank you. And Chief Teehee, let me say that we're excited about this type of partnership because we have longed, of course, outside of a pandemic, to see relationships build and enhance and increase between the county and the city. And so we do think that this is a wonderful opportunity for us to be able to address that concern, as well as have an MOU that we can provide for one another during this pandemic. So certainly we thank you all for this recommendation on tonight. Do we have any other discussion from the council or a motion to approve?
Mayor, before we entertain a motion, the document that I passed out was a revised MOU from the one that was in your packet. And I wanted to point out the revision because what we're asking you to approve is the MOU that has been presented, which is the one that I've passed out. So if you look on number 7, paragraph 7, this is the mutual release and hold harmless. What we have included, you can see, is underlined. And so effectively what this would do is, and the reason we have these type of documents is to, of course, try to limit liability. And even though we're partnering together, ensuring that any potential liability falls on the appropriate party. So if there's any liability on behalf of the city police officer, it's due to conduct that was caused by the city officer. Similarly, if there's any liability on behalf of the EMS employee, due to their acts, it falls upon them, and not their acts fall upon the city, city's acts fall upon EMS. And so by including this additional provision to include in the indemnification of hold harmless, any conduct with respect to any employees upon each other's agencies, we've also extended that to any third parties. So the indemnification would be if, let's say, there was some negligent act upon that the officer engaged in, then that would require the city to indemnify, to the extent provided by law, EMS in those cases if we were sued. And similarly, if the conduct of the EMS personnel were to be based upon their own negligence, then the city would be protected from liability by requiring EMS to indemnify and hold harmless the city officer for that. So that's what the intent of that revision is, to be a mutual indemnification of the parties so that effectively everyone's responsible for their own actions. So that's what I'm asking for approval. If the council chooses to approve this MOU, to approve the version as presented.
Thank you, Mr. Tucker.
Yes.
I make a motion we approve as per the MOU as presented.
Second.
We have a motion and a second. Roll call.
Tracy Hous.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Item number 10.
Receive, report, and discuss the status of Muskogee County Health Department vaccine distribution program and take other necessary action.
This is my agenda item, but I will only provide preliminary comments. I believe that Mr. Miller and maybe Mr. Evans perhaps may have other comments to make to this item on tonight. But let me say that it was quite a joy last Friday to witness the partnerships between multiple agencies in our community. And we were able to successfully vaccinate 1,164 individuals, most of them in the criteria of being 65 years and older, and others being first responders. It was a massive coordination effort that went on very smoothly. All of the compliments and comments that we received are credits to the EMS at the county and city level, as well as those other agencies and organizations who helped to make that event a success. We say to all of our residents, particularly with reference to the Muskogee County Health Department, that our health departments at the county level across the state are doing the best they can with the limited resources that they have. We were only able to do what we did on this past Friday in concert with working together, because no one agency in Oklahoma has the physical capacity to be able to vaccinate people at the rate that some others might think we should be able to do. And so we did what we could with the numbers that we had. We do know that the county is doing what they can to be certain that they are able to relieve the bottleneck and the backlog in terms of being able to make appointments. Many of the systems that they are using were either off of the shelf or handed down to them, and at a moment's notice, these county officials have to retrofit many of those technologies that they thought they would be able to get running perfectly. They're not running as perfect as they could, but that's no fault of their own. So we certainly want to acknowledge all of those individuals at the city, county, and otherwise who did such a wonderful job on this past weekend vaccinating those 1,164 individuals. We understand today that many of them have been contacted for round 2 for their second booster shot of the Pfizer vaccine that was presented to them on last Friday. And so we are looking forward to working with those agencies again to be certain that we can do what we can to improve the health and well-being of all of our residents here in the city of Muskogee. as well as the multiple counties that are associated with our health department system as we try to further advance the cause of fighting COVID-19. Mr. Miller, I'm not certain if we have any other guests or otherwise, but we will yield the floor to you at this time.
Yes, just very briefly, to name our partner organizations, Muskogee Fire Department, Muskogee Police Department, as well as Muskogee County EMS and others. The Health Department, of course, is a lead agency, and they did a very good job and made the event run very smoothly. What we're looking to do, what we know is that was just a start, right? That there's a whole lot left to do of work in Muskogee, in the city, in the county, and in Oklahoma, as well as the nation. So what we have, Mr. Evans is here. He's going to talk a little bit about what next steps are, and I believe we have someone from the health department as well that can address kind of where we go from here.
Thank you.
And good afternoon, Mr. Mayor, members of council. I would like to start off by saying that last Friday's vaccination clinic at the Civic Center was very successful. As Mr. Mayor stated, that we had vaccinated over 1,100 people between the hours of 9 and 3. But this could not have been possible with the help of many different organizations and departments that came together to make this happen. Muskogee County Health Department, and also the other District 7 health departments, which include Adair, Cherokee, Haskell, McIntosh, Okfuskee, Okmulgee, and Sequoia health departments, all came there to help pass out these vaccines. I also like to thank the Muskogee County EMS, Muskogee County Emergency Management, the Muskogee Police Department, Fire Department, and Code Enforcement, and the Muskogee Civic Center staff for setting everything up. They were the ones responsible for setting up all the tables, all the chairs, the barricades, making sure the inside was set up the way the health department had requested. And also Neighbors Building Neighbors for providing refreshments and snacks for our responders that were there. I know there are a lot of questions concerning the vaccine, such as what do people do if they were not able to get in for this Friday's clinic or last Friday's clinic. There's been an overwhelming response from those wishing to receive the vaccine, which is great. And we want to administer as many vaccines as quickly as possible, but we also have to follow the framework, the vaccination framework that was provided by the federal government and who is eligible to receive those vaccines within those phases. To talk about the vaccine plan moving forward and how to get an appointment to receive a vaccine, I have asked Doug Walton from the Muskogee County Health Department to answer some of those questions. Mr. Walton?
Yes, hi Tyler, Mayor and Council. Can everyone hear me okay?
Yes.
Yes.
Okay, great. I'm actually having a little bit of distortion coming through on the audio, more so than I can remember. I don't know if there's anything on that end, but I will try my best to hear everything that you may say. But yes, just really wanted to start by expressing our appreciation from the Muskogee County Health Department and the other 7 counties in our region and staff who were there at the Civic Center on Friday, and really all of the great assistance that we received from the city and county, and all of our partners who came together. Could not have been possible to do nearly as many vaccinations as we did that day without everyone there doing their part, and so really do appreciate it. And so we are, as Mr. Miller said, just getting going with this. We've moved well through phase 1 of the framework for the vaccinations, and are now in the phase 2, which involves still first responders and healthcare workers that are in non-hospital outpatient settings, as well as those working in the care of the deceased and others in other medical facilities, as well as adults age 65 and older, and adults of any age with comorbidities, as well as teachers and staff pre-K through 12, and other public health staff that are involved at the city and county level, or those within government that come into contact with people at risk. So it's a large group, just at phase 2. It's just getting going at the county health department. At least for us, it's going to be 1 week at a time, based on the availability of vaccine that's provided to us through the state. We know that this week we're doing vaccinations on Monday, Wednesday, and Friday. These are all by appointment. Those are in the morning on Monday and Wednesday and all day on Friday. And then Tuesday and Thursday we're doing COVID testing again, as we have been, free, no appointment required for the testing, 8:30 to noon. What we're recommending for people that haven't had the vaccine yet is to use the registration portal. It's vaccinate.oklahoma.gov. It's a online registration system where people can enter their information and basically answer questions that allow them to be placed into the proper group for testing based on the responses to a variety of questions. This doesn't immediately schedule a person. It simply gets them in the system with all the information that needs to be collected. And then as the appointments become available based on the availability of the vaccination, those appointments will be uploaded into the system, and then people will be plugged into those according to their registration status and the time that they registered. We also did, before that came online, Thursday of last week, and let's be honest, I know some of you have probably heard, if you've in fact tried to use it first few days and even through the weekend and possibly even still today, there have been some, initial challenges with just the different pieces of the application and things that I know they're working on around the clock to get fixed so that it doesn't have any flaws or glitches. But it's something that is really just now in its first few days of use, and I know will be refined as they move through the process. But we did start a waiting list manually here at the health department that we really are reserving for individuals who lack internet access or the ability to use an online registration application and don't have a family or a friend who can help them with that. And so we're really trying to steer everyone through that system and have the means to get people on a waiting list. However, it really probably will be quicker for people to use the vaccination portal. I did want to report that besides the 1,167 vaccines that were provided on Friday, we've also administered another 690 vaccinations, which really didn't start until I think the first one was given on the 22nd of December. And I think that's about all that I had to report, unless there's something else, Tyler, that you had asked me to talk about.
Thank you, Mr. Walton. I believe that is it. I'll reiterate some facts for residents that are watching at home. As Mr. Walton stated, if you go to vaccinate.oklahoma.gov, that is the online portal the state of Oklahoma has rolled out to receive updates on when you're eligible to receive the vaccine. It will also give you updates on the upcoming clinics. We understand there's been some frustrations online, some comments posted some concerns posted by our citizens about they're not able to see any upcoming clinics, or not able to book an appointment for this week or next week. And we understand that the appointments are filling up very quick and have been booked up. I ask that our residents follow the Muskogee County Health Department page, the Oklahoma State Health Department page, to try to keep up to date when those clinics become available, when those appointments become available, when the different groups in the phases also become available. I've been reached out by a resident expressing some concern about maybe double booking or triple booking, and I wanted to cover that real quick. If you have an opportunity through one of the tribal nations to receive a vaccine, or you have an opportunity maybe through the VA to receive a vaccine, to go through that route. What we don't want to see is people triple booking. Let's say you have an opportunity to receive a vaccine from the VA, so you book an appointment there, the same thing with the tribal nations, and then turn on and do the same thing with the Muskogee County Health Department. So we ask that if you have a route to receive the vaccine that it will work for you, to please pursue that route, but please don't take up 3 different appointments and take 2 appointments from somebody else that maybe don't have the same possibility to do the other 2 routes. We ask for your patience in this. As Mr. Mayor stated earlier, the Muskogee County Health Department is working with what's provided to them by the state. There's a limited number of vaccines as given to the Muskogee County Health Department, and limited number of resources and tools that they can use. So please be patient with them. They're doing the best that they can with the tools and resources that they do have. Are there any questions for me?
I have a question for Mr. Walton. Doug, this is the mayor. The question I have is, in terms of the online portal versus physically calling the health department, are you all suggesting that they not call, or that they use the portal, or that they should do both?
Thank you, Mayor, for that question. Yeah, we really are suggesting to use the portal, to only use the portal if one has the means to do that. And to, in terms of scheduling an appointment, I mean, we really want anyone to call who has a question or a need from us. But in terms of scheduling an appointment, if a person has internet access and the means to use that method, then we are encouraging that method, as opposed to trying to call to schedule one through the health department. That's correct.
And the follow-up question I have to that is there a mechanism for those individuals who do not have access to the internet?
Well, that's where we have been putting people on a waiting list for us to call them back when we do have appointments available. But we're really trying to manage that and not let that list get so large that it gets pushed back, because it becomes a matter of basically being able to receive that call, basically, to have the staff and the time to receive that call, to put them on a list, and then to be able to call back at a later time, or get them entered into the system, which we're not yet sure if we will actually be able to do that without a lot more information from each person. And on top of the clerical tasks involved with actually holding vaccination events and the other essential, health services that we're providing. So as little calling as is necessary or possible related to actually scheduling a vaccine appointment is kind of what we're pushing for. I did also, Mayor, have one other quick follow-up that I remembered I should have mentioned earlier, and that's just that while clearly our priority here at the health department has shifted to focus on getting these vaccines out as quickly as and effectively as possible, we really cannot forget about the importance of the things that we have been recommending from the very beginning to reduce the spread. We are seeing rates of spread that are as great as they have been to date in the city and the county. We have more active cases in the city than we have to date, nearly 700 active cases right now in Muskogee. In the county, almost 1,050 active cases. And those rates are continuing to increase, and they will for a good amount of time before the vaccine can actually start providing a measurable benefit to reduce spread. And so we have to continue relying on the things that we have been, and that I know the city has been supporting, wearing face coverings whenever in public, anywhere, and maintaining distance of at least 6 feet from people, and not getting too close to people for more than 15 minutes, even with a face mask on, because that's a close contact, and then washing our hands just as often as possible. If we do those three things with diligence, then we really can slow the spread while we have a chance for the vaccination to take effect. But it's going to take many, many weeks and really into the months to reach the entire population of the state of Oklahoma, and that's going to take some time for that to actually have an impact. So that was all that I needed to say on that.
And Mr. Walton, I have one last thing. That is, with regards to those individuals that call in, I'm sure that Mr. Evans and Mr. Havens have gotten the same concern. What do they do if they can't get through on the phone line?
Oh, gosh. I know that's been a problem. I actually had the pleasure of answering the phones a couple days last week because we were short here in terms of trying to do everything with people that were out sick, and as well as the vaccinations and such. And we just don't have enough lines and enough people to answer them. I encourage people to really be as patient and persistent as possible to just find another task to do while waiting on someone to answer the phone, and continue calling back. If you get to a voice message, go ahead and leave one. But honestly, I think it's better to get a live person that can answer it. We're trying our best to return every call, every message that gets left. Facebook for sure. If you're on Facebook or have a friend or family, that most any question that you might have has been answered on there, and all of the updates about the plans for vaccination clinics and scheduling are there. But if a person is needing to get through for anything, for now, I just ask you to be as patient and diligent as you can, and just keep trying, and you will get through, and someone will answer, and they'll be as kind to you as they possibly can.
Thank you.
Tyler, I just wanted to add a little bit to what has been said. A lot of the questions that I had have been answered tonight, but I want us to try to address the issue. One of the things that have been really breaking my heart this week is that the clarity of the whole COVID vaccination process to our seniors. A lot of them don't have access to the internet. And so we need to try to figure out a way to make sure that we get this information out. I've had a whole lot of calls this week. By the time they found out about it, we were already booked. And so we just need to make sure that we try to figure out a marketing plan, get some partnering organizations to help us get the word out to our seniors, as well as even in the next phase, when these vaccinations are available.
Yes, sir. We'll look into it, see what's available for us. That concludes my update, Mr. Mayor.
Mr. Mayor, may I be recognized?
Yes.
So when we first started this program, the first goal was to get all of us first responders vaccinated, correct?
That was part of the phase, yes, sir.
Okay, let's take it one by one, Tyler. Now we got the first responders done. Let's go by list, what we all got done right now, up to this date.
Okay. I don't have the phases in front of me. Do you have the phases with you?
No, I'm asking you.
All right, I don't have it memorized.
You don't have it, okay.
It's the health department and the state's list, sir.
Okay.
Yeah, it's not my list.
Okay. So the nursing homes, have they all been vaccinated? People in the nursing homes?
That is a question for the health department.
Doug, you still there?
Yes, sir, I am.
Are the vaccinations been passed out to all the nursing home facilities? The people in the nursing homes already been vaccinated?
We at the health department were asked to help vaccinate at one of the nursing homes in the county. All of the others were able to participate through the federal Medicare, Medicaid services with the partnership between Walgreens and CVS Pharmacy, and they pretty much completely handled that. I honestly do not know at this moment in time if they have all been vaccinated or not. I know that many of them had been, but it's something that we have not even had any involvement with other than the one that was not able for I'm not sure what reason to get into that, and we on a Saturday went and vaccinated 56 residents and staff at that facility. Your other question, the healthcare workers that are also in that phase one that are within the hospital setting, those vaccinations were distributed straight from the State Department of Health to those healthcare providers. Initially, in that just the first day after receipt of the first vaccine into the state, they sent 7,800 vaccinations through Integris and 9,700 through St. Francis Healthcare System, and they were putting those out to their frontline healthcare workers. And then the only other two groups in that phase one were the public health staff that are working frontline, the nurses and others like those here at the health department, and then state licensed emergency medical technicians and paramedics. To my knowledge, most all of that group has had the opportunity to receive vaccination, and that's what's allowed us to move into phase two, which does include the first responders, the healthcare workers that are in outpatient settings, the adults age 65 and older, with the adults also of other ages with comorbidities, staff and residents within congregate locations and work sites, teachers and staff of pre-K through 12, and then other public health staff and county, city staff leaders that are at risk for exposure. So it's a very, very large group, this phase two, that is just now getting going.
Okay. Like I said, I was just curious because the group Saturday, that was for people 65 and older, correct? Am I wrong?
No, you're exactly right. That was one of the groups that was we were able to begin vaccinating just really last week. A couple of our clinics days were dedicated to that group, age 65 and older, as well as any first responders and healthcare workers in outpatient care. And that's who we will continue working with, those three groups until the state tells us to expand into any of the other groups in that phase two.
What do we do about the people 65 and older that don't have a way to get there, to get vaccinated?
Right. No, it is a concern. We know that people were bringing friends and family to the Civic Center on Friday, people that were, too old to drive or otherwise. And I think my guess is that whatever could be done to help facilitate transportation for people who can't get here should be done. But I also know that that won't be something that the health department can do. It'll have to be something that another partner or group of partners can come together to help with, to get them here to receive a vaccination.
That'd be good, Doug, because like I said, there's a lot of people out there that want it, but they can't get there. You can't get there if you don't have a way. And I have two more questions and I'm done. What type of vaccination is it? Is it Pfizer or the other one that we're doing? Are we doing both of them?
I'm sorry, were you asking me, Counselor?
On the vaccination? What type are we doing the
Yes,
Pfizer, or are we doing the other?
We've been
method?
providing both the Pfizer and the Moderna vaccine. We've received both of those. It was the Pfizer that was provided through the event at the Civic Center, mostly Moderna that we've been able to provide through our scheduled appointments through the health department, at the health department. But it just varies depending on what the state sends us.
And Mr. Evans, you probably can answer this question for me. With the tribes, the Cherokees, and the Creek, do you have to have a card to go over there and get vaccinated?
I cannot answer that question.
Yeah. I heard you didn't, but that would be a good thing for people to know. If you don't have to have a card, that you can go out to the Three Rivers here and go over to Muskogee to the Creek Nation and get, somebody needs to be checking that out and and getting with those people and, with the tribes and see, because that would be a big help, for our citizens also.
Absolutely.
Counselor Van, I did speak with the medical director at Three Rivers last week. He did tell me with regard to the Cherokee Nation that their vaccine distribution is a call-in by them only. So there's no way to call the Cherokees and schedule your vaccination. They are sending out robocalls to all their people who are eligible, and so they've asked that folks who are Cherokee do not call to try to schedule a vaccine, that if they are eligible, they will receive a phone call from the tribe. And that only applies to Cherokee.
But you hadn't heard anything about the other?
I have not heard anything about the Creek Nation, no.
Okay. I'll turn the floor back over to you, Mr. Mayor. Thank you, Mr.
Thank you.
Evans and Doug, for your hard work.
Mr. Mayor, I just had a question.
Yes.
For Doug, what is the vaccination? What do we have available? We still got plenty. Hello?
Boy, I am so sorry. If that question was directed to me, I could just barely understand it.
I was just asking the availability.
For me?
What's the availability vaccination that we have available? What do they send? And what we have left?
How many do we have left? Is that the question? I'm so sorry.
Yes, sir.
Okay, great. I have some numbers that I had handy that, let me see if I can help you with that. At this moment in time, we've got 350 doses on hand as of today. And those should be enough to handle what we have scheduled this week. That is the intention, and that's the task at hand, is that we, never are scheduling more than we have available.
Okay.
And it's, but that's what I can tell you right now at this moment.
Thank you.
I will say to one of the comments that was made earlier, one of my volunteer duties at the Civic Center was traffic control, and about a third of the people who came through the line were brought there by someone else. And so relatives and friends were carpooling and doing what they could to get other people there. And so we want to encourage the community through civic organizations and churches, people that you are comfortable with being around in close proximity, that if you are able to transport someone to one of these events, certainly that you will do so until such point in time where we are have the capacity as a county or a city to make arrangements that are safe. But it was at least a third of those individuals who were there last Friday. They were actually transported there by someone else. And so people are taking consideration to try to get other people there who do not have transportation. So, thank you. Item number 11.
Discuss the Oklahoma Department of Transportation's virtual open house for improvements along U.S. Highway 69 and take other necessary action.
We want to take this opportunity to remind all of our residents that part of our responsibility to guaranteeing that we have the Muskogee that we deserve is going to be directly connected to the outcome of the widening project on Highway 69. For those of us who can recall, about 18 months or so ago, there was an effort to build a bypass around Muskogee. If that would have happened it would have derailed much of our economic development prospects that we need along Highway 69 in order for our city to be viable. That bypass process is no longer on the table, and what is on the table now for the city of Muskogee is to widen the existing 69 highway that goes from South 64th in the direction of Okmulgee, from southbound to northbound. We want to take this opportunity to say to all of our residents on tonight that the very last day to have your voice heard for what could be the best opportunity for Muskogee to grow is January 18th. January 18th is the day that the online public comment section regarding the widening of Highway 69 closes. I have a personal preference, as well as others who may go onto the website. My personal preference is that we develop Highway 69 similar to what has been done in front of Quick Trip, where it is 6 lanes with a middle turn lane that does not have a median. The reason why I'm so preferential towards that option is because it is one of the best options in terms of spurring economic development along Highway 69. Since I've been on the council and since I've been a resident of Muskogee, the common complaint about Highway 69, especially southbound, has been the condition of the structures along Highway 69. Dilapidated hotels or hotels that are in existence that may need to be upgraded or placed somewhere else. We're asking all of the residents to remember that in order for Highway 69 to develop and in order for the city to prosper, it takes more than the voices of the council. It takes more than the face of the city being the mayor. It will take every resident engaging the online process to be certain that our voices are heard. We've been presented with information that suggests that not having a median can be dangerous or cause accidents. But the study that is being referenced was done in 1999. For those of us who are old enough to remember, Prince, I believe, wrote a song that said, "We will party like it's 1999. That was a number of years ago. In 1999, most of us were using pagers. In 1999, cell phones were the size of physical bricks. And so I would just encourage the residents to remember that if we're faced with questions concerning what we desire versus what's being presented to us in the study, that the study is as old as Prince. And so I want to take this opportunity to also encourage those who desire business growth, economic development for our city to consider that option. If you look at what's going on the northbound side of Highway 69, where there are 7 lanes, 3 going each direction with a middle turn lane versus a median, economic development has been allowed to grow. We have a Quick Trip along that aforementioned corridor that is the 3rd producing Quick Trip in the state of Oklahoma. Directly across the street from that, we have a Starbucks that is there, to the surprise of many who did not think Starbucks could exist in Muskogee. Starbucks is never without a line. They are very busy and extremely popular, not only to our residents, but to those who have the ease of access to getting to it. There are talks of other opportunities in that same area. We believe that if we develop Highway 69 in the widening project, similar to what we see in the Quick Trip and Starbucks area, that it has the greatest potential to spur the same type of economic growth and economic development. The reason why I want to impress upon the residents the importance of their participation in this online venue is because if it does not come to full fruition, it won't be because we didn't try. It will be because people did not allow their voices to be heard. And so we want to take this time to encourage the residents to please participate in the online venue. I do not have that specific reference to the website in front of me. I'm going to ask either Mr. Tucker or Mr. Miller to give us what that actual website is, and to definitely encourage all of our residents to go online and participate. Normally, the public comment section is held in a physical meeting, but due to the restrictions associated with COVID-19 regarding physical meetings, the public comments process is all virtual. And so, again, we're asking all of our residents to please participate, because it will take your voices and your input to let the Oklahoma Department of Transportation be fully aware of what we would like to have as a viable community. There will be others, certainly, who have a different opinion about what that should be, and we do not want to attempt to demonize their thoughts or their ideals, but certainly as the mayor of the city, along with some of my other colleagues who I have visited with, we want to be certain that we give the city of Muskogee its greatest opportunity for growth and not settle for less. The last thing we want as a community is to say we should have done something that we did not take the opportunity that our voices could allow to happen. Mr. Miller has come to the microphone with that address.
Yes, sir. It is www.odot.org/US69 Muskogee. So again, www.odot.org/US69 Muskogee.
That is the online virtual access for the residents to participate. I'm asking my colleagues, if it's okay with them, that they will please share that information with their various constituents and those that they come into contact with, as well as say to our residents to please engage this process so that we're not left with something that's less than we deserve. Do we have any questions from the council on that item?
Yeah, Mr. Mayor, I'll be recognized.
Yes.
You said a whole lot. And we, like I said, on the south side, in Ward 3, from Muskogee all the way to Peak, we've been trying to get that done for years and years and years and years. Because when you drive through Muskogee, coming each way, going north or south, you see those hotels. Boy, that just makes our city look like trash. And these people say that all the time. You know, and I'm glad that we're going to finally do something to get those hotels tore down. Mr. Miller, no. Tore down. Councilman Reed, no. Tore down. So it can make our city look like something, you know. But one thing I'd like to ask the opinion of, you know, you said just a while ago about being on the north side, about not having any center lanes. We got a woman up here that, oh, she knows the highway. She knows the highway. And so I would like her opinion of what she thinks about this. Councilman Morgan, what do you think about the difference in the highway going north, the highway going south? Would you think the center meter need to be taken out? Because trust me, I know you know the roads.
Yes, I do. I do like the 7-lane a lot better. If you have a center median in there, you have to take care of it, and I don't want that to look trashy eventually if it starts to grow up or whatnot. But I do like the 7 lanes. I think that'd be a lot better for Muskogee in the long run.
Thank you.
Mm-hmm.
I'm the type of person, I don't like asking, I'll call them jackleg folks. People don't know what they're doing. That's what you call a jackleg person. Stephanie, she's a professional. This is her business. She deals with the wrecks and everything on these highways.
Mm-hmm.
So, like I said, I like taking advice from people that really know what they're doing. That's just me. So I'll turn the floor back over to you, Mr. Mayor.
And the last thing I'll say before we close that agenda item, to the point that was made, that is our main appearance to the city. And we have the opportunity to say to people when they drive through Muskogee, we do care about how our city looks, and that we're taking whatever opportunities we have to make it a better place. So thank you, council, for tonight. We have 2 citizens signed up to speak to us on tonight. The first one we will recognize is Stephen Ezel. We're going to ask that you come to the microphone. Mr. Ezel, give us your name and your address, and you will have 3 minutes.
I hope you all bear with me this evening. This is going to be a little difficult. My name is Stephen Dwayne Ezel, 6121 South 6th Street East. I'm here this evening in my position as a state chaplain with the Department of Oklahoma's American Legion, and also as commander for the Sons of the American Legion Squadron here in Muskogee. About the COVID situation, nearly 4 weeks ago, I lost a very, very dear friend to COVID-19. You all read the article that was probably about him in last Thursday's paper, Paul McKinstry. He was a very, very dear friend to me. In fact, he was my very first instructor when I was just a young, green, cocky as all get out medic nearly 28 years ago. And first time he ever met me, several of us, he said, "Holy smokes, what in blue blazes have the recruiters sent me? How do they expect me to make medics if they don't send me any semi-intelligent human beings to begin with?" And I responded by saying, "Sergeant McKinstry, sir, you're not exactly a blue ribbon prize at the state fair yourself." And he just basically laughed and said, "I like you. I think I got something to work with." And he and I became very, very close friends. We went through a lot together. We started Hot Dogs and Heroes together. We did the clothing drive together, which was his last activity before his passing. And I'm here tonight on his behalf to let you know that one, Hot Dogs and Heroes program will continue. Two, for all of Paul's outstanding service to the community, I want to propose that the City Council approve conferring a posthumous key to the city with certificate or whatnot to his family. And thirdly, although Paul was retired from the service, it is going to take quite some time, and Mayor Coleman, you know, having been retired from the VA, to get his benefits through. And his family is right now kind of in some dire straits. So I would like to encourage people, if they wish to make some personal contributions to help out his family, if you need to get in contact with me how to arrange it, you can the city clerk has my phone number, or you can reach me by email at, it's all in lowercase letters, ezel_Stephen@yahoo.com, and I'll be glad to help any way I can. And I will be glad to answer any questions or concerns anyone might have. But he was my friend, and I'm going to miss him very terribly.
Thank you, Mr. Ezel. The next person having signed up to speak to us on tonight is Deputy Mayor Derek Reed. I'll ask that you give us your name and your address, and you'll have 3 minutes.
Thank you, Mayor. Derek Reed, 550 South 7th Street here in the city of Muskogee. I come today with a personal invitation to the community, those who are tuned in the midst of what all we've been going through with COVID and the unrest, the election. Let us not forget that the 18th of January is a day that our nation will pause to remember the life and legacy of Dr. Martin Luther King. If I had more than 3 minutes, I would invite Reverend Cutler to come up and sing and preach about it. What the world needs now is love, sweet love. It's the only thing that we have just too little of. On the 18th of January, we know that there are COVID concerns, and so we're going to have a safe holiday as possible on that day. We will have a parade that will start at 12 o'clock noon. The parade lineup this year will not require registration. You can come line up on 11th Street. We will have volunteers that will come and give you a number at that time as far as the number entry for the parade, and then the parade will start promptly at 12 o'clock noon. The lineup staging area is the 12th Street area, the North 12th Street area, and the parade route will be starting from 12th Street, coming up Martin Luther King Street, and ending on North 3rd Street. At the end of the parade, we have a couple of sponsors that will give out a sack lunch to all those who are in attendance. We have over 300 lunches. Chick-fil-A is one of our sponsors, and we will just give out a snack lunch. Usually we have a free pancake breakfast. This year we won't be able to do that, and afterwards we usually have food trucks and everything. So we still just wanted to come out in the spirit of Martin Luther King on that day with that ceremony. Once again, the parade will start at 12 o'clock noon and proceed up Martin Luther King Street. At the end of the parade, one of the great things that we always have is spirit-filled church services. We usually have an 11 o'clock service, and then we usually come back that night. This year, there will be one service that will be held at 2 o'clock p.m., and it will be held at the Old Agency Baptist Church on 24th Street. The church service will be a parking lot outdoor service. Just pull up, sit in your cars, and enjoy gospel music by a citywide mass choir, and I believe the keynote speaker for the afternoon will be Dr. Larry Smith, the proud pastor of the Macedonia Baptist Church here in the city of Muskogee. So once again, we just like to encourage the community in the spirit of Dr. Martin Luther King to come out. Many people who have asked me, you know, what do you think Dr. Martin Luther King would say about today? And I'm remembering one of his quotes. He said, "We must learn to live together as brothers, or we will perish together as fools." Thank you.
Thank you, Deputy Reed.
Mr. Mayor, I hope I'm not out of order. I was just curious. This probably has never happened up here before, but Councilman Reed Deputy Mayor Reed has a point. I would like to see us all in here. Since Reverend Cutler is here, can we sing just a verse of "We Shall Overcome"?
We can't do that because it's not on the agenda item. We can't address those who speak on tonight. So, thank you. Item number 12.
That's right.
Consider an executive session to discuss and take possible action on the following. A, pursuant to Section 307B4, Title 25, Oklahoma statutes, consider convening an executive session to discuss the workers' compensation claim of Larry Fennell, and if necessary, take appropriate action in open session.
We need a motion to go into executive session.
Move for approval.
Second. It's been properly moved that we go into executive session at this time. Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. We're going to ask that those others who are here that are not on the agenda for executive session, if you excuse yourself from the room at this time. We will now reconvene from executive session. Roll call.
Mayor Marlon Coleman.
Here.
Deputy Mayor Derek Reed.
Here.
Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs. Here. Alex Reynolds. Here. Stephanie Morgan.
Here.
Tracy McGee.
Here.
Tracy Hoos.
Mr. Tucker.
Thank you, Mayor. Item 12A, pursuant to Section 307B4, Title 25, Oklahoma statutes, the City Council did convene an executive session to discuss the workers' compensation claim of Larry Fennell. After being briefed on the status of that claim and a potential settlement, I believe an appropriate motion of the council would be to move approval to authorize the city attorney to settle the workers' compensation claim of Larry Fennell within the range discussed within executive session.
Do we have a motion?
Move for approval. Second.
It's been properly moved and seconded. Roll call.
Tracy Hoos.
Yes.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs. Jamie Stout.
Yes.
Ivory Van.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. And with that, we are adjourned.